South Korea's healthcare sector in a crisis as trainee doctors stand their ground and refuse to return to work, and that's despite threat of suspension and legal action. The nationwide strike against government plans to increase medical school admissions now onto its second week and showing no signs of resolution.
South Korea's junior doctors are not backing down. Their week-long protests continue unabated despite an ultimatum from the government. They've been told to return to work or face prosecution and suspension if they do not return to hospitals this week.
3월부터는 미복귀자에 대해 법과 원칙에 따라 최소 3개월의 면허 정지 처분과 관련 사법 절차의 진행이 불가피합니다. 면허정지 처분은 그 사유가 기록에 남아 해외 취업 등 이후 진로에도 영향을 미칠 수 있다는 점을 명심해 주시기 바랍니다.
More than 10,000 have resigned, forcing hospitals to turn away patients and cancel surgeries. Authorities have begun an investigation into key officials of two medical associations over possible legal violations related to the ongoing strike. Police also warn they will crack down on any illegal acts during a large-scale rally of doctors slated for next week. The protests are meant to get the government to reverse its policy to improve medical services by increasing medical school admissions. Having one of the world's fastest aging populations, South Korea has been suffering from a dire shortage of doctors. But those already in healthcare say the government should turn its sights on improving their pay and working conditions rather than adding to their numbers.
환자의 생명과 직결된 그러한 의료를 하는 내과, 외과, 소아과, 산부인과, 응급의학과 같은 영역에서 일하는 선생님들께서는 전부 다 이제 내가 언제 의료 소송을 당할지 모른다라는 그런 부담감을 안고 일을 하고 있습니다.
저희 기본적으로 100시간 이상 근무합니다. 출근 시간이 8시, 9시 생각하시는 분들이 있는데 새벽 4시 아니면 새벽 6시입니다. 그 다음에 월급 무슨 몇 천만 원 받는 줄 아는데 200만 원에서 400만 원을 받아요. 병원은 지금의 이 한국 시스템, 훌륭한 한국 의료는 이 전공의들, 싼 의사를 갈아서 만들고 있는 겁니다.
Senior doctors and private practitioners who have stayed out of the walkout are also urging the government to scrap its plan. But Seoul is standing firm. The country's education ministry says medical school admissions will increase by late March.